So I invite both of you. Thank you so much for joining us.
Thank you. Thank you for
We are
having
from
us.
Software Speech Hearing and Vertigo Clinic, which comes under Software Private Limited. We are a full-fledged audiology and speech therapy clinical chain, and we provide all four segments of services to our patients, which includes complete diagnostic hearing test and hearing aids. We are also into newborn hearing screening and cochlear implant following audioverbal therapy. We are also into complete vertigo diagnostics and vertigo rehabilitation following all the maneuvers what we have so far. And we are also into speech therapy services, which includes voice, stroke, swallowing, and other therapies for children. I thank you for joining us. I would like you to introduce yourself.
Hello. Thank you for having us both. My name is Tharin. I'm working as an audiologist at the moment while pursuing a PhD in tinnitus. So I mainly work in the adult rehabilitation area, so dealing with mainly elderly patients. But yes, so I started doing my PhD about 2 years ago now, and hoping to finish by the end of the year or next year.
Great.
Thank you.
Yeah, and then my name is Shermin. I'm actually from Singapore. I had like clinical experiences back in Singapore for about 5-6 years before moving over to Australia, South Australia specifically. Currently now I'm doing my PhD in audiology, and currently I'm in my 3rd year, hopefully finishing by the end of this year. Yeah.
That's great. So we are celebrating World Hearing Day today. What would you like to say to the people who are having a hearing problem or people who are well with their hearing?
Happy World Hearing Day, everyone. Very important to go get your hearing tested, whether or not you have a hearing loss or not, or take someone who you think might have a hearing loss to get their ears tested.
Yeah. Yeah, I mean, happy World Hearing Day. To all, I would say that, if you actually do find that, you have trouble like communicating with like your family members, or if you're not sure about like certain things about your hearing, don't be afraid. Like, just try to like seek help by going to any of like, the hearing centers. We are very friendly and we are like, able to help you.
That's great. So we have few questions which we would like to understand from your perspective, having international experiences from different universities and different work culture, and also having treating different patients from different continents of the world.
Yeah.
We would like to have some insights from you, especially for understanding that what are the most common causes of hearing loss are there, and are there any preventable measures which patients can take or people can take?
Yeah, so in Australia, the common causes of hearing loss would be presbycusis, which is your age-related hearing loss, as well as we've got work noise exposure as well. So those are our main common causes that we see in clinic in an adult population. So about 1 in 7 people in Australia will be diagnosed with a hearing loss by 2050, I think it was, which is quite a high number. So although we do see those kind of people in clinic, it takes someone on average about 7 years to come and get their hearing tested to accept the fact that they've got a hearing loss, which is quite a long time. So at the moment, we're trying to bridge that gap with more public awareness of hearing, which is where, World Hearing Day comes in as well. Great initiative. Preventable measures. So something like, age-related hearing loss. Unfortunately, as we get older, we tend to lose our hearing. It's just, normal wear and tear of the body. But for things like noise exposure, especially from work. The Australian government's put in an initiative that started in the 1980s, where if your workplace is particularly noisy, then you have to wear hearing protection. So these can be things like earmuffs or foam inserts, things like that. And they will also undergo yearly testing, hearing testing as part of their medical to make sure that if they do have a hearing loss, they are taken care of. So far, it's been an excellent initiative. However, there are still some people who, although they are required to wear hearing protection through work, they don't because they're not comfortable wearing it. Or just some work noise places are just very noisy, and regardless of whether or not you wear hearing protection, you will end up with a hearing loss, unfortunately. But like I said, the Australian government is pretty good at being able to provide facilities and testing, as well as compensation for people that have experienced hearing loss from work.
Yeah, I think like what Tharin has wonderfully said. She has covered pretty much like, the main parts of like Australia. Maybe I will talk from like Singapore's point of view. Yeah,
Please.
so yeah. So in Singapore itself, like it's pretty much the same thing too. Like the main common cause would be, OH hearing, which is presbycusis, like what Tharin says, and then like the common like ear infections for like younger children, yeah, and even like noise-induced hearing loss for some people who are like in those like noisy environment, who work in noisy environment. One thing good about like the Singapore government is that like they do actually have this initiative where we have like this like mobile hearing clinic for like people like 65 and above, where they kind of like do hearing screenings for them as like the first line of like detection of hearing loss. And then if let's say they were detected with hearing loss, the next step would be actually to for them to actually go to like the main hospitals, like the government hospitals, where they actually kind of like do more intervention. Yeah, but from an individual point of note, like there are actually like various programs done by like hospitals and even like the school in Singapore, where they will actually talk about like hearing protection, the three things, like to walk away from noise if it gets too noisy, to wear like your hearing protection, and even to turn down the volume when needed. Yeah.
There are also a few rules like 60-60. When you are wearing headphones or earphones, you should go for 60 minutes for less than 60% of the volume allowed in your
That's right.
devices.
Yeah, I mean, there are like even some like apps or even like built in like for Apple and like even Android phones, they will tell you like even like through your watch, say that it's a bit noisy, you kind of like need to turn down the volume. Yeah.
That's right.
When you do hearing screening for adults or for young people, do you find that they are aware of this fact?
Not really. It's their smart devices usually have warnings, but people tend to ignore them because I don't think they realize the severity of the situation and what noise can actually do to your hearing. So a lot of it is just public education. Most of the time when I see younger people in clinic, so younger adults and things like that, most of the appointment is taken up by me just discussing safe noise levels with them. Most of the time they're not aware, unfortunately. Yeah.
Great. And how do you feel that the hearing problem can affect their quality of life, and at what extent it affects?
Yeah, so actually this is part of like my PhD itself. So
That's great.
yeah, we are actually like looking into, so based on like the studies, we're specifically looking into how like having like hearing loss, how it impacts like social and like relationship functions. Like for example, like having hearing loss, does it impact like my relationship with my co-workers or even with like my husband or my wife? Yeah. And then there are even studies shown that, it does also affect like cognitive behavior.
Mhm.
Yeah, and even like, day-to-day, like, communication and like, in general quality of life.
That's right, yeah. So we often find, with the elderly population that I see in clinic,
Yeah.
when they don't hear properly, they're unable to participate in conversations. Say, they meet up with their family once a week. So Australia is a very individualistic society where, you don't really have multi-generational households. So you'll have elderly people living by themselves. So they'll often, once a week or twice a week or whatever, meet up with their family. And, during those times, for example, they're not able to hear their grandchildren. They can't talk to their sons and daughters too well. There's that disconnect in their communication. So unfortunately, this results in them not wanting to participate in those situations. So, I've seen clients where they've just refused to go out altogether. They are in denial that they've got a hearing loss, so they think it's everyone else's problem. They don't think there's anything wrong with them, and they rather just stay at home all day because to them, in their eyes, it is a part of getting older, unfortunately. So yeah, so isolation is a big thing, and that that brings with it depression, that brings with it anxiety, and that has other effects on and impacts on the rest of your life. So it's it's just people aren't aware of what a big thing hearing is in relation to the our whole life, basically. Yeah, it's not given that much importance as our other senses are. Yeah.
Great. So generally, when you find people coming with this hearing complaint, are they coming accompanied with their family members, their
Yeah.
somebody who
So
is a caregiver, or they come alone?
yeah, so the place that I work for, we have a huge focus on getting a companion to come with the person, whether it be their children, their partners, their carers, etc., someone that can be there for support mainly, but also, contribute to the conversation. So, when I ask them questions like, where do you have problems hearing? Most times the person will be like, oh, I've got no problems. This is where the companions can chime in and be like, oh, the TV is, you have the TV quite loud. Or when I call you on the phone, you don't hear many things. Or when I'm talking to you, it seems like you're not listening to me, those kind of things. So having a companion there is very, very useful to the conversation. It helps us as an audiologist, bring forward the conversation into a very helpful area of rehabilitation and hopefully, the person's acceptance of their hearing loss. So yeah.
Yeah, I think like to add on, like, because having worked both in Singapore and Australia, I do see like a slight difference, maybe because like cultural rise. Like in Singapore itself, like, especially for elderly people, they're really like dependent on their like children to like bring them for like, hearing appointments or any medical appointments. Whereas like for I think the people like, in Australia itself, the elderly seems to be a bit more independent and they're just like, bit more in what's called like self-aware in terms of what they need to take for their own health. Yeah.
Right.
Yeah.
So it's a bit different, I would say.
Yeah, they are. The elderly here are they try to maintain their independence as much as they can,
Yeah.
which has its pros, but it also has its cons. But yeah.
How well are they aware about preventive measures for their hearing loss? When you see patients for basic hearing screening or sent for just for diagnosis, even they have come for like people will go for full body checkup. Do you find people to come for hearing test yearly or
No.
in 2 years or 3 years? No.
Unfortunately, that's not a thing here. Again, public health. That's just what it is. Couple of years ago, pre-COVID, we, the audiology body in Australia was trying to incorporate hearing checkups as part of an elderly, over 65 yearly checkup that they have from the government. So we were trying to incorporate that, but because of COVID, everything's kind of taken a back seat, unfortunately. But so I encourage everyone over the age of 60 to get their hearing tested every 12 months.
Yeah.
So we work on a recall system. So even if someone, it's been seen that they've got a hearing loss, if they're not willing to do something about the hearing loss now, I tell them that's fine. I give them more information, and then I ask them to come back in 12 months. So we keep a checkup every 12 months. I find that in that way, if they are coming every 12 months, they are more aware that their hearing is deteriorating. They are more aware of their hearing loss in general because now they've got more information about hearing. So they're more willing to come by themselves, and see when they actually, they're more likely to go ahead with hearing rehab, which is good. And we've had better outcomes that way as well. So in the long term with just rehab, so just with hearing devices and things like that, we find that the patient tends to be a bit more realistic when it comes to their expectations with rehabilitation, things like that. But no, so yeah, we're trying to kind of incorporate, over 60, come in every year kind of message in the community. So yeah, hopefully that will yield good positive results in the long term. But in terms of preventative measures, people generally here are not aware of preventative measures. So far as to say, if they're using power tools at home, most people will now think, oh, that's quite loud, I'll put something on my ears. But if they don't have earmuffs at home, they're not going to go out and buy those earmuffs. Okay, so they're aware of it to an extent, but there's that disconnect between them being aware of it and them actually doing something about it. So it's also our job as an audiologist to kind of bridge that gap, give them more information, and just be there to support them, basically.
Even I find that young populations are much more comfortable, and they encourage the louder the music is, more enjoyable it is.
Tell me about it.
Yeah.
Every
The side
young
effects, they are
person, that's
never
right.
complaining.
It's like every young person thinks they're invincible and nothing's going to happen to them. So I think that's the big issue there. But yeah.
There are also culture that people go outside and they enjoy loud music.
Oh yeah, like the clubs,
which is like
school.
more than 120 decibels, and they are not aware that this much of loud music can actually damage their hearing.
That's right. That's right. And then I'll bring up, after you went to the club, did you hear ringing in your ears?
Exactly.
And they'll say yes, but it went away after a day. I was like, that ringing is a sign that something's not good with your hearing.
It's like a warning.
It's a warning sign to your brain. So.
And that's what your research is as well, no?
That's right. Yes, specifically in tinnitus. So it's a good kind of interconnect, because I was training to specialize in tinnitus before I came across the project. So it's been quite excellent having the two marry up, so I can keep doing my clinical work and also do research. So.
And this is one of the very unhappy area where for our community as an audiologist, where we are not left with a good solution for the patients.
That's
doing research on that. Hopefully we'll bring something to the community and for the public society.
I hope so. It's very under-researched. No one wants to put money into tinnitus for some reason. It's not very well spoken about. I find that it's very taboo. Oftentimes people associate it with getting older, or they associate it with their workplace, so they don't complain about it or discuss it. And if you're not discussing it, public awareness doesn't increase. Public awareness doesn't increase, then we're not going to get funding for it. It doesn't become that much of an issue to get funding for it. So there has been more tinnitus research in the past couple of years, which is excellent. And hopefully I can keep adding to that.
That's great.
Yeah. So I would like to ask that, what are some common misconceptions people having about hearing and hearing health, hearing loss and hearing health?
So I think I brought this up briefly before, but
Huh.
most common misconception I come across is that people think hearing is an accepted part of getting older. Like, oh, I'm 78 years old. Of course, I'm not going to hear the doorbell.
Yeah.
But, you know, naturally, there are some things that we're going to lose over time.
Yeah.
You know, it's not just our ears that we use to hear. Obviously, it's our ears and the brain working together. So
That's true.
obviously, there's an aspect of cognition there.
Yeah.
But yeah, it's just they're not aware that there are certain things that we should be hearing versus certain things that we should not be hearing. It's not good that we're not able to hear an entire sentence a grandchild has said, things like that, you know. Again, it's all talking to the patient about realistic expectations. Yeah. Do you want to add something?
Yeah, I'm just thinking like,
Mm-hmm.
because you ask like the difference between hearing loss and hearing health, is that right?
It is not actually difference. Perceptions or misconceptions that people are having right now.
Yeah, about
Oh,
health, yeah.
okay.
Yeah.
Oh,
Misconceptions.
misconceptions of
Yeah.
hearing health.
Yeah.
Okay.
And
Because
just
there are a
hearing
lot of
in general.
patients who will come and they will deny to wear the hearing aids. They will deny to accept the solutions. So they will tell that now we are at 78 or 79 years of age, and
That's correct.
our life expectancy is not that much, so it is better we can manage. So these are the things
That's right.
the patient.
Yeah,
It's like a worldwide issue.
it is.
It's
It
not
is.
even just in Australia, it's in Singapore too. I'm
Yes,
pretty
yes,
sure in
everywhere.
India it's the same thing too.
That's
Everywhere.
right.
Other
Yeah.
positive countries as well.
I'm
Even
trying to
Mauritius
get.
people have-
At the moment, I've got an uncle. My oldest uncle is 84 years old. So I'm
Oh.
trying to get him to wear hearing aids. And it's a struggle. It's a struggle because, you know, we sit in one room, very small room. He cannot hear what I'm saying. We have to yell at him all the time. But every time we bring up getting his ears checked or getting hearing aids, all he says is, I'm more than 80 years old. I don't want to hear anything. Okay. So
I'm done with my life. I have experienced
Done with my
everything.
exactly
Yeah.
right. Exactly right. So I think then bringing the conversation back to a companion is excellent because then they can put in their input of how the person's hearing loss is affecting them.
Yeah.
So that really changes perceptions
Yeah.
for the person as well, because oftentimes the person is they come from a very kind of like a one-sided opinion on how it's affecting them, but they don't realize that it's affecting others as well. They're not being able to communicate. So
I don't know. I think it's actually really more of like the generational thinking
as well, yeah.
like because like our grandparents' generation, which is like now,
Yeah.
they kind of have like this mindset where because they come from like the post-war generation, so their thinking is a bit more different. They're like, oh, if I can not trouble my child,
I can cope with it.
Yeah, and I, like to me, like, I'm dependent on my child, as long as things are done for me, I don't really need to think about anything. But then, like, I think, like, for example, like our parents, like the
boomer generation,
yeah, they're like more actually inclined of like, what is going to like, help me with my health. They are a bit more like intuitive in seeking help and support, which I'm actually seeing more and more like
That's so
coming
good.
from my
Yeah.
patients.
That's good.
Yeah.
Yes.
So I think it's just a generational thinking, to be honest.
Oh, that definitely. Another misconception I see is that younger people don't think they can have a hearing loss.
Oh,
Yes,
Yeah.
that's true. That's true.
So
And then they don't accept.
they don't. It's so hard to get a younger person to come to terms with the fact that they have a hearing loss, because most of the time, especially if they have like a single-sided hearing loss, they can compensate, right? Because cognitively they're doing well, so they can compensate. So they don't realize when you actually do the test and a hearing loss turns up, they don't think that the hearing loss is as bad as it shows in the test because they're getting by in life fine.
That's true.
Yeah.
That's true.
Yeah. So, I mean, I find it's best in that case to get the person to come back in 6 months' time and then we do another test. So I kind of try and like keep contact up with them. Because the more I see them, the more they think about their hearing.
Yeah, that's true.
That's the important part.
That's true.
Yeah.
And
So
even
then they're yeah.
in such cases, when you go for the solution like cross, it
Yeah.
is very
Oh,
hard to
cross.
make
Oh,
them believe that it is helping actually, because they will start
exactly.
comparing with normal hearing. That as
That's
I'm hearing
right.
from the normal ear, it should be similarly from the affected ear. So sometimes it becomes very hard to explain that you're not going to hear anything from the affected ear, which is nearly
Exactly
that
right.
in terms of
Exactly
audio
right.
processing.
Exactly
Yeah.
right.
But speaking
So
about that,
there
yeah. Oh no, go for
people
it.
people who are good with their intellectual understanding, they
Mhm.
will accept your explanation, but others will reject
No,
straight up.
that's right.
I don't know.
That's
Yeah.
I
right.
do
Yeah.
have patients who are like that
Yeah.
actually, like both in Singapore and Australia.
Yeah.
Like I have very young clientele, like maybe between 20 to 40 years old.
Mhm.
Because some of them, like, they do not have like the newborn screening
Oh,
at the
that's
point
right.
of
Yeah.
time. They kind of miss that period. So it was like later discovered that, they have like hearing loss. And most of their concern is that, like, they're very worried of like how their peers view them, especially when I was back in Singapore. So like what
Yeah.
you say, like cross and all that, they might feel that, oh, it's very like, obvious. People can kind of see
Yeah,
the
that's
aids,
right. And
and
it
then
feels like it ages them,
uncomfortable.
right? Yeah.
Yeah, but I think
Yeah.
that there are actually a lot more new companies coming out, like hearables,
Yeah.
that
Over the counter stuff as well.
that's right, like AirPods looking like devices, but they do actually help by boosting like the
Yeah,
hearing.
they're not as good as hearing aids, but
Yeah.
it's something at least,
At
right?
least it kind of like start them off with something, which
Yeah.
I think like that was what I did for a few of my patients. It did
Oh,
work.
it's pretty good.
Yeah,
Pretty good.
eventually, like, they are more confident,
Mm.
and then they realize that, probably they need to get like a proper device. So that's when the hearing aids come in. So it's like
Yeah.
easing them in.
Yeah.
Yeah.
Transition
And since we are
period.
talking here
Yeah.
about as you mentioned that newborn hearing screening are not happening well, and there are a few research which says that nearly 4 in 1,000 newborns will have congenital deafness.
Oh,
But they
yes,
are
that's
missed
right.
out and not getting a hearing test, a proper diagnostic test. Because in most of the countries, even if the newborn hearing screening is happening, it is happening by some technician who doesn't understand the factor affecting those hearing test results.
Okay.
Everybody knows that OE is the test, they put the ear and they will get the
Yeah,
result later
that's
or
right.
pass. But
That's
what are the
right.
factors which can affect this? So that is where our importance being played on. That if it is an audiologist, he will understand or she will understand all its variables to manage, and accordingly they can give the accuracy and reliable test results. So what do you think? Where should we focus as concerning the importance of early identification and intervention? What do you say?
So in Australia, we've got pretty good systems for that. So every state has their own run newborn hearing screening.
Yeah.
So which means every hospital will have, the newborn hearing screening is administered by a nurse who's trained up to do that. But then they will be overseen by an actual audiologist. Yeah.
That's
so
very good.
that's it's quite good because that way the audiologist makes the final decision, right?
Yeah.
So every major hospital here, they have an audiological clinic, mainly a pediatric one most of the time. So if they have if the child has a fail, they get automatically referred on to proper diagnostics. So they will do the full workup. But that being said, sometimes, so most of the time it's caught now, the congenital hearing losses.
You can kind of miss.
Yeah, you can miss the single-sided hearing losses. That's
especially. And some of them like kind of like have it like after birth.
Yep. So they'll develop it in their younger years. So we have a really good
5-6 years.
Yeah, 5-6 years. Over here, the educators at kindergarten level, at school level, primary school level, the teachers are actually taught how to identify children who may need, like learning needs or hearing losses, things like that. So if a child is even just identified for a learning need, they will actually go get their hearing assessed as well. just automatically.
Yeah.
It's part of their
Yeah.
diagnostics as well.
Yes.
Okay.
So it's trying to cover all the bases. However, in Australia, the biggest issue that we have is not in the metropolitan areas, it's in our regional and our rural areas
Yeah.
because there's a lack of access in health, which I'm sure in India you'll experience that as well.
Yeah.
The more
Yeah.
kind of,
Yeah.
that's right. So we have issues there. So there are a lot of kids over in those areas that
Missed
get
out.
missed.
Yeah.
So at Flinders University, we do have
Right.
a
Program.
we have a screening program. So the master's students here, every term, they go to schools who are
Slightly further.
slightly further out, who have a big Indigenous population. So we go there and do screening tests on them, those kids as well. So whoever's been missed, hopefully will be picked up. Things like that. The children over here do get funding once their hearing loss has been picked up until they're 26 by the Australian government for hearing aids, as well as sound fill systems if they need that in school, Roger pens, things like that. It's all funded and taken care of. Cochlear implants as well. So they give preference to babies that need them. So I think the earliest a baby can get
Before
implanted was
1.
6 months, I think it was.
Yeah.
Yeah.
Great.
And these are the protocols which are given by JCASH, Joint Commission on Infant Hearing Screening.
Oh, yeah. That's
Yeah.
right.
So
That's
the
right,
latest
that's right.
protocol is that which you are mentioning, that at 6 months they should be given this cochlear
Yeah.
implantation,
Exactly
That's
right.
and
right.
at
Exactly
3 months all the diagnostic must be done.
Must be done.
So
That's
Yeah.
right. Yeah.
when these tests like OE screening is done by some technician,
Yeah.
and in the cases of neuropathy in children, it will come
Yeah.
present.
Yeah, that's right.
But
That's
then
right.
if it is not repeated later on
Exactly.
with other tests like AABR,
Mhm.
we will
Yes.
not understand that person like child is actually reported as hearing well, but in their
Yeah, but he's actually
he will
not.
not
That's
be
right.
hearing well. So
That's
that is
right.
where the importance of, I think, cardiologist comes.
Yeah, of course.
Yeah, of course, that's the
Just
tricky.
this is
Yeah.
one of the one. And I have
Yeah,
seen
it is.
some of the patients who were who were identified at the age of 4 years or 5 years, and then when they started the process, by then it became very hard for them to get this CI done or any rehabilitation plan to be
Because
done,
there's a age
because the speech
limitation.
and language was completely delayed.
Of course.
Already it is 4 years. So I think the parents should be aware that just basic OE test is just a basic test, but we have to follow the protocol up to 3 months to actually finally say that your child is completely normal.
100%. That's
Yeah.
right.
Right?
Yeah, that's
It's
right.
true. It's the same actually in Singapore
Is
too.
it? Yep.
Like we have a system too. Yeah, like what you say, sometimes like, there are cases where like I think it's pretty good in terms of like, parents catching up on like children having delayed speech. But sometimes like, 2 to 3 years old is the tricky bit, even over here in Australia.
Yeah, it's very hard.
Sometimes they think that, maybe my child is a late talker.
Yeah.
That's why, the child is not like, speaking. But actually, the true fact is that they're not hearing well. And surprisingly, like, when parents found out that, actually, like, the children has hearing loss, that's where they like was shocked and they blamed themselves because they think that, they were not like,
Didn't pick up on it.
careful
Yeah, that's
enough,
right.
like, to find this out.
Yeah, but on the flip side as well, some
Yeah.
parents are in denial as well that their
Yes.
child is not perfect.
Yeah.
Yeah, so that also, that kind of delays the process of them getting diagnostically tested and things like that, which delays, further down the line. The more of a delays there at the start, the more there is at the back end of the thing. So
Tricky.
it's tricky. Yeah, it's tricky. But
Personally, me, sometimes I feel like the parents are actually innocent. They don't understand the effects of these
yeah, of
problems on the
course, of
children,
course.
or how it has happened and how it happens. The pathophysiologically, if we think about it, neuroscientific manner, if we think about it, they will not be aware. So I think our job is to help all the healthcare system to be on place, and they should believe what we are saying. We are not saying everything just to generate business or profit. It is just to control the disability numbers and to reduce them. That is what the job we are doing. That is why we we study for 6-8 years, we work for 5-10 years, we still go for the research and we do PhD and all. Why are we doing this? We are bringing all this skill and the knowledge to better serve the community which are around the globe.
That's
And
That's
especially
exactly
caring about their hearing,
Yeah.
caring about everyone's hearing.
That's why, like, nowadays, like, social media is such a powerful tool. Like, I see a lot of, like, audiologists and even doctors, like, just going up on TikTok or Instagram, like, or Facebook or YouTube, just sharing about this awareness
Yeah.
so that, more and more people kind of are aware.
They're aware. Yeah.
Yeah.
Public
And
health
that is why I
awareness.
think we are also having this discussion to help
Yeah.
the public be aware.
Yeah.
Yeah.
We will come up with some other questions where we will ask that what are our importance are there as an audiologist, why audiologists are important to the community and public. Are we an important aspect of our community? Are we playing an important role in their life? Are we really going to help them, or we are just commercialized?
Yeah.
So this is
That's
how
true.
they think about us. So these are the questions which we have to be answering to the public.
Of course.
Yeah.
Also, this is a very sad part when parents come with their child, and due to lack of this awareness about their hearing health, many parents come to us when the child is at the age of 10 or 11, and at that time even we are able to diagnose correct hearing loss and we are able to do the management, but then again the prognosis of the language acquisition is not good. So
Exactly. Yeah.
this is also a very sad part, and particularly in the rural areas where the awareness about the hearing and hearing health is not much, and the parents are not very much of aware what to do, where to go, who to find.
That's right. That's right.
Yeah.
I think that kind of rural problem is all over the world.
Yeah.
Yeah.
Like, really, a government like approach has to come in.
Yeah.
Really,
Definitely.
it's really very hard. Or maybe like, a non-profit organization.
Yeah. But even with the non-profit organizations, it's just that limitations, funding is basically
Oh yeah.
yeah. Basically the main limitation,
Issue.
main issue,
Yeah.
funding everywhere. But yeah, I think
funding is not happening everywhere in every corner of the world.
no.
It is happening in a few countries only.
That's
Okay,
true.
otherwise, if people are doing their research, they have to fund themselves.
That's right. That's right. It's a good
I'm
thing
doing
we
my
both
research,
are.
I'm funding myself.
Oh,
yourself.
there you go.
Oh,
No,
wow.
we're getting funded at the moment, but
Good.
we're very lucky that we got the funding,
Yeah, we're very
especially especially for the topics that we're doing. But yeah, so I mean, all it comes down to is public awareness, right? So like Sherman was saying, social media is a great tool.
Yeah, it's free.
Yeah, it's free. We've had quite a few people who I've seen, younger people come in. They've come in because they've seen a TikTok about ears.
Yeah, or like ear wax.
Oh,
It's like a
candling as well,
a
ear
very
candling,
topic.
things like that,
Yeah.
So they've come in, that's been the first step into the doors
Yeah.
to a clinic to get their hearing checked. Things like that. But there's also that perception as well, like what you were saying before, that audiology is becoming a lot more commercialized than just clinical. So it's kind of heading towards what optometrists have become, I think.
Yeah.
In my opinion, I feel like
it gets tricky.
Yeah, it gets
sometimes.
tricky. It gets tricky to balance, especially if you work for a bigger company or an international company.
Yeah.
It gets very tricky to balance the business side of things with the clinical side of things.
It's true.
But I'm very fortunate with myself and my team that I work with. We're very, very focused on patient health. So that's been our number one priority. So I've always said to people, especially students that I supervise and things like that, if you're focusing on patient health, the money will come.
Yeah.
That's just how it moves.
Yeah.
Even we are following the same
Good.
thought process.
Yeah.
That's right.
We started
That's right.
here leaving everything.
Yeah.
And we
Patient
focus
centric.
only the quality, and we tell them that
Yeah.
if you are happy with our services, I hope you are the one will be willing to pay us to
Exactly right.
continue the services similarly as we are providing today.
Exactly. And there's, so many different clinics now.
And they
So
can tell,
yeah, they
actually.
can, the
They can
patient
tell
themselves can tell.
whether
And
you're
word of
sincere.
exactly. And
Yeah.
word of mouth is the biggest thing.
Exactly.
If someone has had a good experience with you as a clinician, they are going to tell
Literally.
their friends about it, and the friends will come to see you.
Yeah.
So I've found it really good. Like you obviously try and maintain
The
good
relationship.
interpersonal connections with
Just
everyone.
can
and
see
things
them
like
like
that.
very often.
That's right. But then on the flip side, especially if the person doesn't want to be there, whatever you do, however you treat them, they're always going to come out with a negative experience.
That's right.
Yeah,
Agree.
yeah.
Yeah, that's right.
And
Yeah.
what do you think that
Mm.
person or the public, when should they seek for a professional help, and what are those minor symptoms they can find in themselves that I might be getting some sort of hearing problem, or this is one of the symptoms that I should be considering myself that I have hard of hearing.
Yeah, so one of the first things I tell people to look out for is when they're watching the news, because a newsreader is very articulate
And clear.
and clear. So they're very easy to understand, easy to hear.
Yeah.
If you feel like you're having difficulty hearing the news and you've put the volume up, that's often first indication that you're developing a hearing loss. If you're needing to put the phone on loudspeaker, mobile phones are pretty good these days. People
Yeah.
rarely have an issue with clarity. If you're needing to put it on loudspeaker to hear, you probably have a hearing loss.
Yeah.
If you're needing to
Really?
look at a person's face when you're talking to them,
More often than usual.
yeah, more often than usual, then you probably have a hearing loss,
Probably. Yeah.
So those are the three things I like to focus in on. Because those are the three things that people tell me when they first come in and they're like, this is where I'm having difficulty.
Yeah.
So background noise is a tricky thing to measure. It's very, very difficult.
Very subjective.
Very subjective as well.
Yeah.
So recently I've been finding an influx of younger people. So younger people as in like younger than 40 coming in for a hearing test because they're having issues in background noise
Like
when they go
persistent-
out. When they're going out to see their friends for lunch.
Oh.
Okay. Now, in Australia, we've come to an era where places for lunch and things like that, the acoustics are very bad.
Yeah.
Very, very bad. So
It's really noisy.
here, the young person comes in freaking out that they've got a hearing loss, but it's just bad acoustics.
Yeah.
So oftentimes it's me just explaining to them that it's bad acoustics. And then they're thinking, why did I
Come
test
for
my
this.
hearing? That's right.
Well, it's still good.
no, it's still good. They get a baseline of their hearing and things like that.
Even
Yeah.
when we are
Mm.
when we go for the hearing treatment, these acoustic parameters are very important part in hearing aids.
Exactly right.
And,
That's true.
Yeah,
Yeah.
exactly right. I've been using a lot of, if I find someone coming in with background noise as their main complaint, I've been using quick SIN quite a
good,
bit.
good.
Yeah.
Like
Yeah.
speech test. Like
Yes,
speech.
yeah, quick speech test with background noise in the background, obviously.
Yeah.
That gives me an indication of how they're actually going with background noise, but more importantly, it gives the patient a very realistic approach to how their hearing actually is.
Sure.
So it's been a really good counseling tool.
Yeah. Since we are in India, so in India we are having thousands of languages.
Of
It's
course.
not limited to one language.
Makes
So
it very
every-
hard, doesn't it? Yeah.
So just like if I have to administer quick SIN, it will be limited to a very small percentage of public. So
Yeah.
what we do speech perception test in noise, and that
Okay.
we do a speech perception in quiet and speech perception at variable noise levels.
Yeah.
Oh, that's
Like
good.
we
Just to
do
see the
like we
comparative.
give
Yeah.
speech noise in the background,
Yeah.
and we present the local language. Like we have by our Indian Speech and Hearing Association, we have research base of PB words already developed for different languages.
Oh, that's
So we
good.
use them.
Pretty good.
We
Yeah.
use them to do. And somebody who are English native speaker, for them we can use QuickSyn. We can also we have also some of the recordings received from South Africa.
Yeah.
Similarly, like what we are doing, but it is recorded in English.
Oh, that's
And in
That's pretty good. Yeah.
Maharashtra, they have Maharashtra Association of Speech and Hearing. They have developed Ramsin test,
Yes.
which is
Yeah.
like sentence tests, similarly like QuickSyn. but it is
Okay.
only in Marathi language.
I
Yeah.
see. I
I
see.
think it makes
Yeah,
sense. 'Cause
it does. Yeah.
even in Singapore, like some elderlies, they can't speak English.
Yeah.
So we have to like do it in Mandarin or Malay or even like, you know, in Hindu.
Hindi. Yeah.
Hindi,
Yeah.
sorry.
Yeah.
Yeah.
Good. Yeah. Yeah. Okay.
So,
So
yeah.
that's
Because it's
That's
easier
interesting.
for like people
Yeah,
to
of
understand.
course.
It's not because of like, you know, their perception of like
No.
language.
No, that's right. That's
Yeah.
right. Yeah. Very interesting. Yeah, that's not, something we think about too much over here because
It's just,
mainly English.
yeah.
And if someone does come from an ESL background or if they can't speak English, so a lot of elderly immigrants, then we tend to use Ling or we do a Helen test as well. So this is where Companion is really good because they can then translate the Helen test. So that's been quite good. Yeah.
Very good. Shabina, you have something to discuss?
Yes. In my recent years of practice, like I've seen a lot of patients who are having a normal hearing sensitivity. They're all hearing. So in my recent years of practice, we have seen a lot of patients whose hearing thresholds are within normal range at all frequencies, but they are having complaint about tinnitus. Like suddenly, one fine day they come and say that I am getting a ringing sensation, ringing sound in my ears. So, what are the basic or common causes for this ringing sensation in their ears?
It might be higher frequency like hearing loss.
Yeah.
Because if you think about it, like when we do audiogram, it's very like speech focused, right? Like 250 to 8,000. But in like her testing for her research, it goes even higher than like
That's right.
8,000.
That's right.
And that's where you start to realize there are actually like, you know, hearing loss happening.
That's right. So
Yeah.
because we've been doing extended high frequency testing as part of my PhD protocol, basically what I found with those people who have normal hearing, normal hearing, but developed tinnitus, chronic tinnitus, right?
Yeah.
We found that they actually do have an extended high frequency loss. Okay, not all of them, but quite a few, which can be used to explain it. So then I kind of, use that as a counseling tool to explain tinnitus to them. But on the other hand, I also make sure that I tell the patient that it's very, very hard to pinpoint a reason for tinnitus.
Yes.
So they have to be aware that tinnitus is something, although under research, is not fully understood. Okay, so I kind of try and take as well a psychological approach to it as well.
Yes.
So, if they come to me and they've developed tinnitus, say 2 weeks, 3 weeks ago, and it's just constantly in their ear, I try and get them to recall when they first started noticing it. Right? Because if they're able to pinpoint it, sometimes,
anxiety.
Yeah, that's right. Anxiety, they've gone through some personal trauma in their life, there's stress or whatever that's caused it, then you can use that as a counseling tool for them.
Yeah.
But sometimes there's just not anything to explain it, unfortunately.
It can be even like objective.
Yes.
Like for example, like I mean, personally for me, I have like a heart condition. My hearing is fine, but it's just that I do have like pulsative like tinnitus going on
Yep.
because of like the blood flow.
Blood flow, yeah.
Yeah, so it can be like, other things going on in the body
In the
too.
body as well.
But of course, like, the first thing that people usually would consider, is it like ear related?
Yeah.
So
Is it ear related, basically? So yeah, then I just, I try and counsel as much as I can at the moment. I explain to them that, it's very harmful thinking of tinnitus as a negative signal because it can be, it can exacerbate your tinnitus symptoms, your perception. It can make you notice it more. As soon as you associate negative words to it, like frustration or, annoyance, it will make the tinnitus worse. Okay, so, and then I kind of give them sort of, like, I think it ties into more mindfulness.
exercise.
Sound therapy exercises.
Cognitive behavioral
Yeah,
therapy.
it's all links back to cognitive behavior, which again is what I'm also looking at in my PhD. I tell them to focus on it as a neutral signal. Try and think of it as a neutral signal, because if you tell someone to think of it as a positive signal, they get very discouraged because, once you're annoyed by something, you're not going to find it particularly,
like pleasant
or anything else ever, So telling something, think of it as a positive signal does not work.
Like sometimes you just need to like ask them to like kind of accept it. Yeah. That's like the first step. And then from there, like, find ways to approach it.
That's right. And I find that often, just sending them to an ear, nose, throat specialist as well. Although the ENT is not going to be able to do much, it kind of gives them a sense of comfort that they were checked over and that there's nothing wrong with them.
Yeah, that's true.
So I find that kind of ticking all the boxes is also good because they're thinking, nothing else.
Doing something about it.
That's right. That's right. Now, unfortunately, there are some people who have quite severe tinnitus. To the point where it's, debilitating.
Affecting their life.
Affecting their life and things like that. The most we can do in that situation is refer them to a psychologist, that specializes in tinnitus. Unfortunately, we don't have anyone that does that in South Australia, where we are right now.
We do, like one.
That he retired.
Oh, okay.
Yeah. So he's gone. He's no longer available. Okay. There are a few in Melbourne and Sydney. So I guess that's okay, but we don't have that access at the moment. Which is what I'm researching at the moment as well. So I'm trying to find a CBT protocol that can be audiologist guided, because obviously we're not trained to administer CBT. So I'm trying to look for a protocol that can be audiologist guided that will benefit the end user, because CBT is recognized as a gold treatment. Gold standard treatment for tinnitus at the moment. So
thank you so much for all the inputs. As we are discussing on this World Hearing Day, what would you give as a message to the public out of your years of working experience, and now you're also into research? So your personal message to the public of India, public of Australia, Singapore, and world around, as we are globally humans having the same process of hearing.
Yeah, that's right. I would say, as part of World Hearing Day, hopefully you learnt something. Hopefully you took away something, and hopefully you're able to share your knowledge and increase public awareness. And importantly, just go get your hearing tested. Wherever you are. It's really good, even if you don't think you have a hearing loss, really good to establish a baseline. Keep a copy of your results, so further down the line you can actually assess if your hearing has declined.
That's true. So to add on, it's like, just doing like a body checkup each year, you can just add on by doing like a hearing test.
That's right.
It's the same thing for eyes. I'm pretty sure, like, we check our eyes so often.
Exactly.
So why not the ears too?
That's right. If you're putting that much importance to one of your senses, you got to take care of all the other ones. It's very important.
That's very good. Yeah, great. Shabina, you have something to discuss?
No, you can.
Yeah. So I think the topic of discussion which we had, we think we have covered nearly everything. Would you like to have some discussion with us? You have anything to ask?
Yeah, I was very interested just about India, because obviously you come across many different languages. Do you find that there is, like, with every culture that you come across, there are differences in like their hearing loss acceptance and things like that?
The language is not the main reason, or language is not the barrier for accepting or not accepting. I think it's about the quality of education or awareness in the society. So there are few societies, like more rural they are, poorer the acceptance is. So if they are well educated or not educated, but having somebody in the family educated, or having living in a society where people are understandable, they understand the importance of their lives and senses, they will accept. So some parts of India, in India, we have South India, where acceptance of hearing loss is very good and patients number is high.
That's pretty
Then
good.
second comes to the west part of India, The poorest part of India where the acceptance is lacking is acceptance and awareness both is the north part of India. And that is where we are working.
I see.
Interesting.
Do you guys get any government funding for diagnostics or rehabilitation?
For newborn hearing screening,
Yeah.
there are district level audiology setup,
Programs.
or they hire audiologists at district level where all the newborn hearing tests must be done.
Yeah.
And from there, they will be going to the hospitals where CI is done by some of the ENT hospitals or the big hospitals like Max and all.
Yeah.
AIMS we have in India.
Yeah.
And then ABT
Government-
is provided by speech therapist.
Government
Yes,
is also funding for the CI, cochlear implants,
that's
children who cannot afford, or parents who they cannot afford
Okay.
to do the proper management. So government also provide fund for that.
Oh, that's pretty good.
Yeah.
That's pretty good.
Is it
And I
like a
think similarly,
specific
like you have NHS and all, in India we have CGHS program or different government bodies where people are working. If they are government employee, they will get a hearing aid for free.
Oh,
But
okay.
free hearing aid is not there for normal public, private sector public.
Okay, I see. I
Yeah.
see. Yeah,
They,
so the we work very similar to NHS, but it's called Medicare over here. So if you're under the age of 26, you get everything covered for by the government, as well as if you're a pension age. So if that's over 65 at the moment. But there are some elderly people who don't qualify for a pension. That's when they have private health that comes in. If they have private health insurance,
they have some form of coverage?
some funds will cover a little bit, but other than that, not really. Yeah.
yeah.
Pretty good.
Yeah. Interesting.
How about Singapore, Shermin?
Well, I think Singapore, like in general, like the government is pretty much let me think. We have this thing called like, you know, the Mendaki like society like generation, which is like the elderly generation. So like 65 and above, as long as you have a hearing loss, you kind of am qualified to actually get like some form of like money from the government. So the government kind of like pays 90% of like the hearing aids itself. And of course, like they will go through like some form of funding,
Yep.
like, you know,
Funding body, yeah.
yeah, just to see whether like you meet the requirement. And if you do, like, you know, you just have to like pay 10%. You know, it's just a form of like them also to make sure that, you know, there's some form of responsibility
Of course.
from
Yeah.
like the patient's end rather than getting it free.
Yeah.
Because sometimes like, you know, if you get it free, you might not take
You
it.
don't value it.
Yeah, that's right. You
Yeah.
don't take good care of it
Yeah.
compared to like, you know, paying a bit more money.
That's right.
So
That's
like
right.
the standard price for Singapore is just $300 after like the subsidy itself. And usually they get really good hearing aids. Like the governing like, you know, person, you know, that, you know, takes in like the hearing aids are usually like mid-tier. So for example,
really?
yeah, like for example,
Wow.
like Phonic, you get like 50 or like maybe even 70 sometimes if you were to top up a little bit more. But it's really good and hearing aids actually.
Wow. So the government only subsidizes the very basic level hearing aid
In Australia.
in Australia. So if you do want something a bit better, then you have to pay out of pocket.
Mm.
Yeah. So
Similarly in India as well, for all the government bodies.
that's right. I always say to people, look, it's better to have something rather
And
than not
not
have something.
Yeah.
Budget's a very big issue. But most people can afford to go one level up. Like at least get rechargeable hearing aids, right?
Which is important.
Which is very important. No more batteries. That's right.
Yeah.
Shermin, you are already in your nearly final year of research. So out of your research, what have you found as a result? Or not you? I know that you are not at the conclusion, but out of your result, would you like to say something?
Right. That's a very good question. I recently just submitted one of my papers. It's a qualitative study. We actually did interview some people across like Australia itself, like people with hearing aids or cochlear implants. How was like the journey, getting the hearing aids or the cochlear implants? It was quite interesting actually hearing from like the different people of their stories, their journey of like, even stepping into the clinic, the first time, what was the experience like with the audiologists? Were they helpful enough to like, push them to the next step? And if let's say for those who require like, a cochlear implant, what was the additional step of like, even transiting to the ENT doctor and even like the surgical and post-surgical experiences itself? So I think out of the results itself, we found out that the main thing was the service itself. Like at the end, like, how we audiologists or even the what's it called, primary care, like hearing care practitioners, like the GP, like how do they even like, approach hearing loss when I see a GP? Because like over here, the first person usually if you will see is like the GP.
Yeah, family care doctor, basically.
Family care doctor, yeah. Just to like, seek out what are the next step, like, do I need to be referred to like, a specific doctor or even like, a allied health professional? So we found out that actually that part is very crucial as to what the GP is even telling like, the patient itself. Yeah. Because sometimes like, if it's a bit, the usual like press by cases is pretty easy. Like, oh, okay, please go and see like the audiologist, get the hearing test done. But then if let's say they come with like other issues like balance or maybe even like, other medical concerns that kind of cohabits with like, with like the hearing issues, it gets a bit tricky for the GP to even like give them more advice.
Yeah.
So these were things that we found out, like, it's a bit tricky for them to like, for the patient himself to like handle. Another thing interesting is that like the emotional aspect itself, how we audiologists or even like, any like medical professionals approach them. Because most of the time, like, when we want to do stuff, right, and we have so many patients and it's like so tight in terms of like the schedule timing, we kind of want to like, do it quickly and then like, moving
Get them out, yeah.
yeah, and then move them out kind of situation.
Yeah.
But in the interview itself, it was quite interesting that, these were the main things people were sharing. They share about how their experiences, like, that they have with the audiologist or like maybe with the ENT, that, the approach that was given, it wasn't very like, patient, like care. They didn't really understand their problem. It was more of like the audiologist or the ENT telling them what to do, which there wasn't like much patience, like, initiative or decision, like,
Okay.
being really made. So yeah, it was quite interesting after like finding out based on the interview itself.
Yeah, it's actually very interesting.
Yeah.
That's
And
pretty
with your
cool.
expressions, it's like you are still in that.
Oh yes, because I did some of like the interview calls, so it was quite funny listening to some of like the interviews that like the interviewees when they were like expressing, because some of them really got very upset while talking about it. Yeah, but overall it was quite an interesting experience. I mean, given that I'm a clinician myself, I can see where they're coming from too. Yeah.
That's very good. I
Yeah.
think we are very close to our timing.
Yeah.
So we should wind up our session here. I would like to extend my thanks to both of you and for coming back, accepting us, replying on the email very quickly, and taking all your time in between your research and sitting with us on this World Hearing Day. So thank you so much, Shereen and Tharin.
No worries.
We are very thankful to you. And hopefully in the future also we will have some collaboration for better hearing health for the public around the globe.
Yeah.
Thank you for the invitation.
Yeah.
We will share your messages to the public, and we will also
No
share
worries.
these videos whichever is possible to you as well.
No worries. Thank you for
so
your
much.
time. Thank you for inviting both of us.
Yeah.
It was a really good experience, though. There you go.
Yeah.
Yeah, and hopefully something comes out of it, like good,
It was fun.
Yeah.
Yeah. Thank you so much, Shermin, for joining us.
No worries.
All right, you
Take
Thank
care,
you,
guys.
thank you,
Bye.
and wish you both a happy World Hearing Day.
Thank
Yeah.
you. You too. Have a happy
World
World
Hearing Day,
Hearing Day.
everyone.
No worries,
Yeah.
guys.
Let's raise awareness and bring change in
Of
society.
course. Yes. Big goals right there.
Bye,
One
guys.
step at a
Take
time.
care.
Bye.
Thank you.
Thank you.
Bye.
No
Bye.
worries. Thank you. Bye.